When midline is not clear, I will use a surgical marker to outline it. The reason for this is, if you are exactly midline, there is less bleeding from the skin.
Stabilize the testicle in position using 3 fingers, thumb and index, and then the third finger as a backstop. I tend to use a number 15 or 11 blade. For better precision, I am trying to not cut through the tunic and exteriorize the testicle in the tunic. I have accidentally gone through the tunic, so now the testicle is open and not closed. I use a pair of forceps to hold the tunic. This allows me to strip down, as if we're still closed. Now I break the attachment of the tunic, like we do in a traditional open castration. The tunic is attached to the cremaster muscle and the cremasteric vessels. The cord and testicular vessel are not attached to the tunic. I often use Alice tissue forceps to stop everything from flopping around. Now I place a surgeon's knot with about 5 ones. This is followed with a miller's, again with 5 ones. Castrations, which have died after the surgery, is usually from a slippage or snapping the suture. The pull breaks the testicular vessel, which then slips into the body. The rest of the vessel is visible and an inexperienced surgeon may continue not knowing this has happened. So, work close in and controlled to prevent this hagganing. Also avoid small suture material, as this is more likely to snap. Typically, the dog is not quite right after the surgery, and sadly dies to 2-4 days post-surgery, with no signs of any bleed, as this is occurring in the abdomen. Keep the distance fairly short between the ligations. Now clamp and cut. Avoid crushed tissue returning inside the body. So cut on the body side of the clamp, as shown. Check for bleeding, and then try and nudge the ligated vessel and cord back through the inguinal ring. So, we have closed the vessel and cord. Now to close the muscle and cremasteric vessel. If the cremasteric vessel is not ligated, this is usually why hard painful haematomas occur. I usually close the cord and muscle with cremasteric vessel with a miller's and 5 ones. Again try and push the cord and vessel through the ring. Remove the next testicle. This one came out with tunic intact. Break the attachment with a tearing motion, and then strip down the fat. Once stripped down, I incise the tunic. Then break the attachment to the testicle and repeat the procedure for this side. we made to incisions, so pick up one side, the middle rafts, and then the other side. Tie off and then a continuous pattern to the end, and then tie off again. Cut the end, keep the long piece to run into intradermals. To avoid snapping, use your rat tooth adsense to push the skin over the knot while you pull a little on the suture material.